This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Rafacol Tablet is a medication used to treat inflammatory bowel diseases. It is especially effective for ulcerative colitis and Crohn's disease. Indications and uses. This medication is indicated for managing ulcerative colitis, Crohn's disease, and microscopic colitis. Ulcerative colitis is characterized by inflammation of the inner lining of the colon, while Crohn's disease can affect any part of the gastrointestinal tract. Microscopic colitis presents chronic watery diarrhea and may be diagnosed only through microscopic examination. Budesonide effectively reduces inflammation, providing relief from symptoms associated with these conditions. How it works. Budesonide acts by blocking the production of inflammatory mediators, thus controlling inflammation in the bowel lining. Directions for use. Always take this medication as prescribed by your physician. Swallow the tablet with a full glass of water. Do not crush or chew it. The doctor will determine the correct dosage and duration based on individual health needs, age, and body weight. It's important to continue the treatment as directed and not to stop abruptly without consulting a healthcare provider. Possible side effects. Common side effects can include headache, stomach pain, muscle pain, and mood changes such as depression. Patients should seek medical advice if any side effects are bothersome. Precautions and warnings. Before starting this treatment, inform your doctor about any existing health issues, particularly infections, diabetes, or history of stomach ulcers. Pregnant or breastfeeding women should consult their physician before use. Caution is advised for those with kidney or liver problems, as well as for elderly patients. FAQs. 1. Can I stop taking the medication once my symptoms improve? No, do not stop suddenly without consulting a doctor. 2. Is this medication suitable for children? No, it is not recommended for anyone under 18. 3. Can it cause dizziness? Yes, dizziness is a common side effect. Avoid driving if you feel dizzy. 4. Can I take it if I have diabetes? Use with caution, as it may affect blood sugar levels. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your engagement.